Today, at 8 weeks of gestation, ultrasound findings confirm the diagnosis of a molar pregnancy. A molar pregnancy is a rare complication of pregnancy in which abnormal tissue grows inside the uterus instead of a normal embryo. You can see the gravid uterus, meaning the uterus containing a pregnancy. However, instead of seeing the normal appearance of a developing gestational sac and embryo, we can see abnormal intrauterine tissue. Inside the red circle, there is heterogeneous echogenic tissue containing multiple small cystic spaces. These fluid-filled spaces give the tissue a characteristic grape-like or cluster of grapes appearance, which is a typical ultrasound feature of a molar pregnancy, also called a Hydatidiform mole. A small gestational sac-like structure can also be seen within the abnormal tissue. It appears irregular in shape, rather than having the usual well-defined appearance expected in a normally developing intrauterine pregnancy. Importantly, no definite yolk sac or embryo is visualized within this structure. At around 8 weeks of pregnancy, a normally developing intrauterine pregnancy would generally be expected to show a recognizable embryo with cardiac activity. The multiple red arrows are pointing toward the numerous small cystic spaces within the abnormal tissue. Their clustered appearance is often described as a grape-like or snowstorm appearance, which can strongly suggest a molar pregnancy on ultrasound. Now, let's compare this with a normally developing intrauterine pregnancy. In a normal pregnancy at approximately 8 weeks, ultrasound usually demonstrates a well-defined gestational sac containing a yolk sac and a developing embryo fetus, with cardiac activity visible. The developing embryo is surrounded by the normal fluid-containing gestational environment. In contrast, this ultrasound shows abnormal intrauterine tissue, with multiple cystic spaces and no definite normally developing embryo, making the appearance markedly different from a normal pregnancy at approximately 8 weeks. When we estimate the gestational age using the mean sac diameter, the measured gestational sac-like structure is approximately 11.9 millimeters, strongly suggest a molar pregnancy on ultrasound. Now, inside the green circle, you can see a cyst within the right ovary. It appears simple and fluid-filled, with an anechoic, completely black, internal appearance, a thin, smooth wall, and no obvious solid component or internal septations. This is the typical ultrasound appearance of a simple ovarian cyst. If you found this educational video helpful, like and share it so more people can learn about this condition. And don't forget to subscribe to Experts Health Corner for more simple, evidence-based medical and ultrasound education.